Welcome back to another episode. A couple of weeks ago, I made a post around knee pain, which actually sparked a lot of conversation with lifters that are on my Instagram and clients as well. Now, knee pain is one of those things that I feel like for a lot of lifters, we just accept that it's part of the training process. But I've also had my fair share of knee pain as well. And I can understand how frustrating it is and how debilitating it actually can be session to session, week to week. And the thing is, it's not normal. It's totally not normal. But the reality is often we put up with the pain just because we kind of want to complete our training sessions and we don't want to let down our program, or we have an important event or comp coming up. So we kind of just push through it. But this often leads into like really poor movement, really poor training outcomes, because pain often doesn't just go away. There's a reason why you're in pain for most cases. And it doesn't just go away by sort of pushing it to the side. You need to have a plan in place that's going to essentially allow you to work on your weak areas, work on range, or identify at least what the problem is so that you can sort of make it better and then continue to make progress. Now, you know, something with a knee that's really, really interesting is when you start to get swelling in the knee, the muscles around the knee just go MIA. They just stop working. And it's a fancy term called inhibition, but basically the quad switches off. The quad is so important in knee movement, knee control, knee stability. If you're in a position where you've got chronic swelling over and over and over again, it means that you're working really below the level that you have the ability to work within. You know, you're not getting the most out of your strength. You're not getting the most out of your muscle activation. And the reality is you're probably compensating, which means that something else is wearing the brunt where your knee should actually be controlling that movement. Now, when I look at knee pain, I like to break this into three big categories. And the first one is, technique, and within technique is range of movement and control. The second is your overall training volume, but not just training volume in a sense of like sets and reps for strength training. It's actually also looking at any aerobic stuff you do. Say you do some running, say you're a cyclist, whatever activities you do, you've got to look at the cumulative effort of all of that training volume together and have a look at the dominant patterns that you train over and over again. And then the third one is like, how do we actually manage this? Like, what is the long-term solution for this? So programming considerations is probably one of the biggest things. So let's jump into technique and range of movement. When we look, there's a very simple principle. In order to get into positions and do it effectively over and over and over again, you don't want to be fighting your body to get into position. So you need adequate mobility to then allow you to control the movements, which then allows you to train it. And I often hear and see people kind of like diss on mobility, for instance. But the reality is for any movement that you do, you need to be able to physically get into the position so you're not fighting yourself. So one of the biggest things that we can do is, if you're squatting, deadlifting, single leg deadlifting, whatever the movement is, you need to have enough movement and mobility to actually get into the position. Because if you can't, it's just you're fighting an uphill battle, and that might be okay for a certain period of time, but there will be a point in time where that strategy isn't actually that practical for you anymore, and you end up in pain, you end up, throwing the stress somewhere else in your system. Now, when we look at the knee specifically, it's a very simple joint. Like it's just essentially a simple joint that kind of moves forwards and backwards. Now, there's obviously a lot of nuance around that, but if we actually look at the joint, it's hugely controlled by muscle activation. It's a joint that needs a lot of active stability from the muscles. There are secondary restraints like ligaments and stuff like that, which help to slow things down, but you don't want to be relying on those. You want your muscles to be doing the bulk of the work. But what ends up happening is you often get people with really jacked up, like say hips and really jacked up ankles. And what that means is we then push the pressure into the knee. So the knee ends up doing more work than it has to to essentially get the job done, which the problem with that is then it gets inflammation, then the muscles work less in the actual knee itself, which means that you're just then hanging off ligaments or tendons and these passive structures that don't really want that type of workload. So when we're looking at the knee, we need to assess the ankle. Do we have the adequate range of movement to actually do the movements that we're trying to get into? Is that robust enough? With the hip, is there a strategy that's going to allow you to get in and out of the positions that you need to over and over and over again? And if you are using your hip a lot, for instance, do you have some prehab strategies and some movement strategies in there to make sure that the hip's moving well so that the knee doesn't become the firing line? The knee is often just a messenger in all of this. But the point I'm trying to make here is if you make sure that the joint above and the joint below the actual knee joint itself have the adequate movement that they need, then you can actually look at the knee in a way that's like, okay, what do we need to do at the knee? But often you'll treat the knee and you'll treat the symptoms, or you'll add some exercises in for the knee, but you've missed the hip and the ankle. So you haven't actually identified the actual cause of your knee pain. It's just a symptom that you're dealing with. So how I always like to frame it, you need movement and mobility to actually get into the positions you need. You need to be able to control from a muscle activation level. So the quad, the hamstring, the calf, all of the smaller components that support the actual knee joint itself. And then you need to put it into practice. Often you'll find it's a combination though. It's a combination of you need mobility in your warm up, you need stability drills, and then you need to progressively warm up into your training programs. And if you have a similar structure like that in your training program, honestly, it starts to tick a lot of boxes for you. And you put yourself in a position where if you do, like, because training's not static, you're going to build up tension spots. You're going to have some areas that get sorer. You have a little bit of a standard operating procedure within your actual training program that you go, hey, I've just done a 10 or 20K run. My calves are super jacked. I was meant to squat today, but like I'm trying to warm up and my calves are just so tight. So instantly you go, well, I'm not going to go and squat because I'm going to open up my calves a little bit first, work on my range of movement. Now my squatting is going to be better. So it's almost like a feedback loop where you're checking back on yourself over and over and over again. And I think this is just a really important part for anyone that's training long-term, is just to have these little processes in their actual training program that helps them check back on themselves, because nothing is static in training. It's constantly changing. So the knee itself is actually a pretty simple joint, and it often just wears the brunt of poor training technique and just inability to move properly in the joints above and below. Now, if you do have all this range of movement available to you, you've got great movement, you've got great muscle activation, then we actually need to look at training technique. But I always say that the movement requirement is first, because the training is specific to the position that you're trying to be in. So you're trying to cue, say, pushing your knees out to get your hips working a little bit better. But you have to have the range of movement first. But the training side is actually easy if you have the prerequisite of the movement. So then when you move into your actually training side, and I speak about it all the time, then you can just formulate a process about how you actually go about your training. You tighten up, let's say squatting, you tighten up your upper back, you get your midsection, your brace on, you get your hips nice and tight, and you're nice and balanced on your foot. That part's the easy part often for a lot of people, because it's just building out a repeatable process over and over and over again. But often the hard part is going, hey, I'm in pain. How do I diagnose that? So first step, make sure you have the movement, make sure you can control the ranges, and then you lay a technique on top of it. Now, moving into the next point is training volume and intensity. Often we'll find people that will sit really hard on the volume side of things, and they just want to work, do a lot of sets and reps, build a ton of muscle mass, and we're going to talk about that. But then we get people on the other side as well that are just, they want to add kilos to the bar. Now, in a well-rounded program, you should have both. It should just be a consistent where you're continually growing muscle and you're building strength at the same time. But often we'll find lifters lean into their preferences. Now, when we've got someone that's constantly chasing muscle mass, a lot of the time what we're doing is just shortening that tissue over and over and over again. Now, if we're looking at the knee here, and imagine I've just done 1,000 leg extensions, 1,000 hamstring curls, 1,000 calf raises, and then I've also done 1,000 tibet raises, which is pulling my toe up towards my knee. I've just shortened all the tissues around my G joint. So as I'm going, say I'm about to do a squat now, I'm then asking those muscles to relax, even though they're super jacked, and allow me to get into the bottom of the squat position. Now, the problem with that is often what ends up happening, it yanks on the actual tendons itself. Like it causes pain because there's physical tension pulling on the tendon. And we, often a very big complaint is this knee pain at the front here or just below the kneecap. And one of the big causes can be that just the supporting tissues like the quad are so tight that they're not relaxing during the movement. They should be letting go to allow you to essentially get into the bottom of the squat, but they're not. So that's one big reason. The other side is sometimes when we're pushing strength, we push too hard. Like our nervous system can get the work done, but we're overriding our ability, or we're essentially giving ourselves too much stimulus, which means that you'll just bypass the muscles and you try and create momentum in it. So say for instance, if you've ever seen someone squat and they just dive bomb into the bottom of a squat, they get to the bottom and they almost use like a bounce to get out of the bottom. They're purely using elastic energy. They're trying to use momentum and inertia to get them going. And they're also using the passive tension from the tendons. But the problem with that is you don't then use the muscles to create the actual momentum and movement. So you end up hanging off these tendons over and over and over again, which over time is going to cause pain and inflammation. So when we're looking at it, if you're looking at your training and you are doing a ton of volume, sometimes you need to pull a little bit of volume out. If you are on the strength side of things and you're pushing up your strength, sometimes you need to moderate the strength just to allow everything to settle down. Then you can add some isolated kind of, if you're on the strength side, you can add in some muscle activation work. If you're on the continually shortening and muscle building stage, you can add some like lengthening under load stuff in there, and that will balance things out a little bit. But it's a really important consideration. If you have knee pain, what style of training do you do? Because you're going to have a bias there as well. Now, something that often isn't spoken about is, say for instance, I was a cyclist and I was doing 100 Ks on the bike a week. I'm constantly stuck in a position where my knees are up towards my chest, my hips are really shortened and tight, and actually my knee isn't. My knee's lengthened. So what ends up happening is I get really, really tight at the top of my hip, but then the portion of my quad down by my knee is actually on stretch constantly. It's lengthened out. So I've got a bit of an imbalance going on here. But if I'm doing 100 Ks on a bike, for instance, you're going to repeat that pattern over and over and over again, but then that just becomes your normal. So a common cause of knee pain, this is also related to sitting down all day. A common cause of knee pain can just be an imbalance between a muscle group in itself because you're holding tension too far in one spot than the other. Now, this is all considered. When you're thinking about training volume and training intensity, it's not just the weights that you do in the gym. It's also the other activities, cardiovascular, whether you sit in a sedentary job and you're sitting down all day on a computer. You've got to think about these positions that you're in, because if we're spending 6 to 8 hours in these positions each week or each day, if you're sitting down at a desk, there is going to be a flow-on effect from that. So I think this is something to be quite mindful of as well. Like me, for instance, mate, I never had knee pain, hip pain, back pain until I started spending time sitting down at a computer. It just was not a thing. You're always up, you're always moving. When I was my first job as a chef, I was on my feet all day. When I started as a personal trainer, in between clients, I'd be sitting down in the bottom of squat, stretching out. It wasn't until I then moved into running a business that my system actually started to stiffen up. And, part of that was just the postures that I was in day to day, but the flow-on effect with that was knee pain, right? So you've got to think of all these things together. But how we link all of this together. So the moral of today is, how do we actually link all of this together to help you? Like that's the goal from this. And, it does come down to programming. And I think structural balance is something that as coaches and practitioners, we really need to think of. And if you're training and I'm going to point out some key movements and you don't have exercises in there that target these areas, you need to get a plan that's going to help you to start to work on these weak points. Now, Training, you cannot focus on everything at once. You physically cannot. So you have to phase things throughout the year. So for certain phases of the year, you're going to be focusing on range of movement. You're going to be focusing on, local joint stability. So like isolated movements, hamstring curls, leg extensions, calf raises. But say for instance, I was a powerlifter and I was just about to jump on a powerlifting platform. I'm probably not going to be doing leg extensions because it's kind of null and void at that point. It's actually not helping me with my squat at that point. But at the start of the training programs, that's definitely going to be beneficial because it's going to help to build the muscle and strength in the quads. But there's some key areas here. So if we have a look at strength training in general, these areas get a terrible job. They just do not get looked at the way that they need to. Now, your hamstring, the lower portion of the hamstring, if we think about it, hip thrusts, RDLs, good mornings, back extensions, all of these are targeting the high portion of the hamstrings and the glutes. They're not really working the bottom portion. They obviously are by default getting some work, but we're not working that bulk of tissue down around the knee under load. So what we need to do is strengthen our distal hamstrings, so the part down by our knee, under load and under range of movement. Now, there's not a huge amount of exercises that actually train this, but it's a really important movement to have in your training program. Maybe not year round, but definitely periods. So exercises that fall into this category is a hip bridge variation with your foot extended out, so it stresses the actual distal portion of the hamstring. If you've ever seen someone do a hamstring curl on a Swiss ball, that's actually a really good exercise because your hips are pushed up to the roof and then you're lengthening that tension through the hamstring as you stretch your leg out. Really, really good exercise to combine hip extension whilst you're actually straightening out that knee. So you're really starting to stress that hamstring. Now, there are other variations like you can get on a GHD as well and do isometric holds where it really starts to stress the hamstring in a lengthened position. Then you can start to take it through range of movement. And then we also have this big king and it's a Nordic fall, but the reality is for most people, it's actually way too advanced. You've probably seen it where you're kneeling and there's either someone holding your legs or you're set up in a machine and then you're falling down towards the ground. And the idea is that you can control yourself all the way down and come back up. Now that's obviously stressing out that distal portion of the hamstring, but for most, honestly, that's just an exercise that's probably never really going to be that achievable for you. But the moral of this is these are types of exercises that you need in the program. It doesn't need to be in year round, but it means that you're getting that balance between the hamstring, which is really, really important. And for the knee specifically, the hamstrings actually anchor back the leg, the lower portion of the leg. So say, for instance, I'm going down into a squat. Think of them as two ropes pulling it back. It stops excess movement forward. So that means that it's going to put less pressure on the actual knee, the kneecap, the tendon, everything involved. So really important muscle groups to have activated. Now, I've spoken about this. I actually did a podcast on it, but the calf muscle is so important because it interacts directly with the actual hamstring itself. Now, they crisscross the back across the back of the knee and they're providing this anchor pull force. So training your calf in a straight knee position is really, really important for knee health because a lot of people don't like training calves, rightfully so. It's quite painful. But having them trained in that straight leg position trains that big, bulky calf. And that's the stuff that you need to support the knee. Because think of this. As you're moving forward and your knee's moving forward over your toe, their anchor's at the back. But then we have on the front side of things, the quad, which is also slowing down the movement of the knee going over the toe. But if you just cut out the hamstring and the calf, all of a sudden you're just reliant on your actual quad. That is not a good strategy because you're only running at 50%, right? Now, often we only train what we see. We might see swelling at the front. We might, have an imbalance between our quads where one's bigger, one's smaller. So we work just on that, but we also need to work on the backside to help anchor things down a little bit as well. Now, from a bigger picture as well, when we start to look at it, we need periods of time in our training program where we work really isolated training programs. This is something that I see all the time. Like I see a lot of training programs. I talk to a lot of people through the clinic in terms of treating. And Often we just focus on these big compound movements, big squats, lunges, pull-ups, bench presses, but you need periods of time where you're working the smaller muscle groups. Now, this might not be as fun as, throwing some tin around, pushing yourself to failure on these big compound hack squats. But the reality is, even if it's for a month or 2 months, if you can tighten up the system, hip flexion, hip extension, work the hamstring that I was talking about, work the calf, get some really good direct core work in on the upper body, working on your lats. These are things that solidify your body moving as like one unit. It moves well, it works together, it communicates between the muscle groups, and it gives you better chances of getting better outcomes in your training. So I think this is a huge thing. Structural balance is a huge portion of training programs, which is just overlooked. It's not fun, it's not exciting, it doesn't look great on Instagram, but it's the thing that's going to stop you from being in pain over and over and over again because it links the whole system together. Now, something that, I'm super passionate about with people is being a physio. Obviously we're managing pain, but what's the bigger picture of that? The bigger picture for me is making sure that a training system, a way that someone's training is structured, allows them year round to be working on qualities that helps them be pain-free. And if you need treatment on top of that to enhance something, that's awesome. But you don't want treatment to be your lifeline. You want it to be an aid to assist your training, because the bread and butter of what you actually do in terms of stability, strength and control comes from the sets and reps through the actual training that you do, not through the passive treatment that you get on the table. Now, there's nothing wrong with passive treatment. As you get stronger, you're going to get tight. You're going to need to offload certain areas. That's awesome, but it shouldn't be your main prehab strategy. Your training program should account for a lot of the structural balance and the changes that you need to make in your body. Now, over a year plan, if the simplest way that you can do it, you can dedicate chunks of time. And if you're looking at doing this for yourself, or you look at your training program and you don't have it, you should be spending 3 to 4 months a year working on these smaller qualities, because over a year, there's plenty of time to target all the other stuff. So if this is you, if you're dealing with pain, feel free to reach out to me. And that's it for today's episode. I'll speak to you soon.